What insights have these approaches provided in understanding foot health challenges?
Well, there's a really benefit again in looking at the problem from different angles, and in this case, our angle comes from the gait lab where I work. So I work as a gait lab technician once a week at Amsterdam UMC, where we do the foot pressure mapping in people who are provided with new orthopedic footwear. But we also do the barefoot plantar pressure mapping in order to see, well, what could have caused this ulcer and what is the prognosis of this patient. And we have a variety of lab-based analysis that you can do immediately when a patient visits the clinic. That we can feedback to the doctor to inform the diagnosis and the treatment strategies, and it's really helpful to be able to do that in the lab straight away. And that's also how our scientific studies started. Obviously, in scientific studies, you want to control the environment, and in a gait lab, you can control many environments. You can study really in really high quality. What do the shoe like? How does this shoe work? What does it do? And so from that, we've learned a lot about how we can optimize footwear, for example. And one of the things also that you see now widely implemented in Australia is pressure mapping. So pressure mapping is something that Professor Sico Bus started doing in the gait lab. Let's measure the shoe before we give it to the patient. And from that, we learned that in the lab, you can already straight away see that the pressure in the shoe is too high. You need to change the shoe before you give it to the patient. And that's what we do in the gait lab now. We measure the pressure, and then when we're satisfied, then it goes to the patient. But that's where then the next step needs to be made is into the real life, because then the shoe goes with the patient into the real life. And then we realize that the same shoe in two different patients may have completely different effect, because if that patient takes 10,000 steps a day, or if the same patient only takes 1,000 steps a day, it's a completely different shoe. And what happens in the real life actually matters to what happens to the shoe and to the foot.
Correct.
And that's when we started to do real life gait analysis. So we have an activity monitoring device that we give to patients, and with that we not only count the number of steps, but we also count the quality of the gait, because shoes influence the quality of the gait, and some shoes actually to upload increase or decrease stability, and that you can see in the gait. But also you can see the variety of patterns during the day. Do people walk more steps in the morning than in the evening, or the other way around? Do people shuffle? What is the gait speed? Another question that in the lab we measure the gait speed, but we know that people in the lab, they walk faster than they walk in real life, because the lab is quite controlled, nothing's happening. And in the real life, we now see the differences appear. And it's quite a good correlation, actually. So people who walk faster in the lab also walk faster in real life. And what we're now trying to investigate is, how does that work? Are we seeing any patterns? Are we seeing ulcers more in people who walk faster or who walk slower? And what does it mean? And one of the surprising findings, actually, from our latest research is that we're now seeing emerging a group of patients who get a foot ulcer despite low pressures in the shoes. But those are the patients who walk much slower. And traditionally, we always thought that if you walk faster, or we know that if you walk faster, the pressure is higher. And that could be detrimental. But what we're now seeing is that we're having these fragile patients who walk so slow that the skin can't withstand any pressure anymore, and they break down. And so if you would look at this 10 years ago, you would say like, oh, these shoes are really good. Even if you would look at this 5 years ago, you would say like, shoe has really low pressures, all good. But now, if we look at it now, we go like, oh, wait, this person walks very slow, doesn't walk too many steps. This is a high-risk person that we could need to sort of check really carefully, because something might be happening. And that's how we continuously try to marry what happens in the real life, what can we observe in the lab, and how do we benefit those two most from each other to give the best care and to provide the best knowledge to help prevent these foot ulcers.